Hello people, namaste. Welcome back to my channel. This is the video of continuation of hanging. In previous videos I discussed about the asphyxia. Previous videos I discussed about the classification of hanging and causes of hanging, and also discussed about the postmortem appearance. In that externally I discussed, so in this video I will discuss about the internal postmortem appearance of hanging, how it present internally. See, first we can see the thyroid cartilage factor. Thyroid cartilage fracture. Big thyroid cartilage fracture will occur in this because of hanging. After that, hyoid bone fracture also occur. Hyoid bone fracture. Here, in thyroid greater corner is involved. Hyoid bone fracture is an important short answer question for university exams. See, hyoid bone fracture is seen in greater than 40 years. If generally this fracture is seen the aged persons, like greater than 40 years. Why only greater than 40 years? Means because the bone undergoes totally completely ossified at above the 40 years. So after the ossification, uh, if there is more pressure, it leads to breakage of fracture of hyoid bone. Okay, this is, so I wrote this one only, greater than 40 years hyoid bone fracture, because it completely ossification after 40 years. Next incident, so where we can see this is a hyoid bone fracture, we can see in three conditions, like throttling is most common than hanging. Okay, sometimes throttling is comes under this strangulation. So throttling most common hyoid fracture can be seen, then hanging. After that, ligature strangulation. Next, most common site of this hyoid fracture, the hyoid fracture seen at the junction of inner two-third and one-third of greater horn. See, this is the greater horn or greater cornu. The greater, this is lesser, this is the body of hyoid. So in this place, means inner two-third and outer one-third. inner two-third Inner two-third and outer one-third, this is the most common site of greater cornu of hyoid bone fracture. Okay, so there are two types are there: outward compression and inward compression. See, this is the inward compression. Inward, because of the inward compression, is seen in commonly in throttling. Outward compression, because of outwards, it leads to fracture. This is the outward compression seen in hanging. So I will discuss it. Outward compression is called anterior posterior compression. Inward compression is present. First, outward compression I discussed. Outward compression generally seen at the hanging and strangulation ligature, but inward compression is only seen in the throttling cases. So inward compression only seen in the throttling. Okay, throttling case. What is the mechanism? See, hyoid bone, this is the hyoid bone pushes backwards, then it will be diverged of greater horn broken on the inner aspect. See, pushes backwards. See, this is the greater horn, this is pushes backwards. Greater horn is pushes backwards because of the force the diverging of greater horn. This is the diverging, here converging of greater horn, this is the diverging of greater horn. Because of backward pushes the hyoid bone, there will be diverging of greater horn broke on the inner aspect. So the fracture segment is easily moved outwards, so outward compression is present. So in hanging and strangulation ligature, the outward compression is seen because of the diverging force on the greater horn. Because of the converging force on the greater horn, the pressure is applied outwards. Converging force, the pressure, because of converging, the pressure is applied outwards. So it is called, because of the rupture of the outermost aspect of greater horn, so fracture moves easily inwards. So fracture is moves inwards, so it's called inward compression. Because of convergence, the outward force is more. So it will break to the inward. So this is called inward compression. If there is any divergence, of greater horn, the inward compression is more. Because of inward compression, it will break to the outward. So it is called outward compression. It is seen in hanging, it is seen in throttling. So the next one is also present, side to side compression. Side to side compression is also seen in hanging. One is displaced outwards and other is inwards. One is displaced outwards, other is inwards. It is also generally seen in hanging cases. So hanging cases, what can be seen? Side to side compression and outward compression. These two can be seen in hanging. Only inward compression means converging of greater horn, only seen in throttling cases. So this is the most important short answer question for university exam, hyoid bone fracture. Next, carotid artery injury. Internally, carotid artery injury. Carotid artery means it is generally carotid artery vertebral injuries. All these are seen in sudden drop, like hanging with a long drop. Long drop means like judicial hanging. Judicial hanging cases only we can see these injuries, carotid artery injuries and the vertebral injuries. This one of the sign is present. This is important. Emusat, emusat, SAT, emusat. Emusat sign. It is a transverse intimal tear. Sometimes they will ask in bits. So transverse intimal tear is what is the sign? Emusat sign. MMUSANT. Emusat sign. Transverse intimal tear. Okay. Next, associated with the bruising is a antemortem sign. If there is any bruising is present, then we can call it is an antemortem sign. Carotid artery injury. Next, vertebral injury. Same, due to hanging with a long drop. Means increased force to the neck. It is generally seen in judicial hanging, plus hanging from any tree or any balcony. The two types of fractures are important. Hagman fracture and Simon's hemorrhage. In this Hagman fracture, C3, C4 or C2, C3, C4 fractures can be seen. In Hagman, never C1 is involved. C1 is never involved. Sometimes they given asked in bit. In Hagman fracture, which of the following is not involved? C1, C2, C3. Then you can tell C1 is not involved. Only C2, C3 and C4. Another is also present like spondylolithosis. C2 or the C3. C2 or the C3 vertebra. C2 vertebra or C3 vertebra. This is spondylolithosis. It is also called as Hagman fracture. Hagman fracture. Okay, important. Amusant sign is present in carotid artery because of intimal tear. Because of intimal tear, transverse intimal tear, amusant sign. Next comes to Hagman fracture. C2 or C3 of spondylolithosis or involves C2, C3 or C4. Next, Simon's hemorrhage. Simon's hemorrhage means prolonged suspension. Because of prolonged suspension, bleeding behind the anterior longitudinal ligament. Means stripes like hemorrhages in intervertebral disc between the lumbar vertebrae. See, these are the intervertebral discs now. Because of prolonged suspension, like strips like between vertebrae, it is intervertebral disc. So this intervertebral disc has strip like hemorrhages. Stripes like not strips, stripes like hemorrhages between intervertebral disc between lumbar vertebrae and bleeding behind the anterior longitudinal ligament. Anteriorly longitudinal ligaments are present, so in that parts bleeding will occur. Bleeding in the longitudinal ligaments, anteriorly longitudinal ligaments along with intervertebral disc. At the intervertebral disc there is a stripes like hemorrhages are seen. So it's called Simon's hemorrhage. Simon's hemorrhage. I discussed three important points like Amusant sign, Hagman's fracture, Simon's hemorrhage. Hagman's means C2 or C3. Simon's means intervertebral disc stripe like hemorrhage and bleeding from anterior longitudinal ligament. Next, Amusant's signs means intimal tear. Intimal tear. After that, I discussed about the hyoid bone fracture. This is important. Hyoid bone fracture means like most common site. Most common site is a hyoid bone fracture greater than 40 years. This one and two types like outward, inward. Because of convergence, it is inward compression, throttling. Here hanging. I discussed the internally. Next, manner of death. Manner of death is suicidal, homicidal, and accidental is present of the manner of death. Suicidal, most common method of suicide is hanging or poisoning. See, in this suicidal, most common suicide is hanging or poisoning, because fatal period is only 3 to 5 minutes only, painless death. So most of them are preferred for suicide, hanging as a suicide method. Okay, hanging as suicide method. Next, homicide. Homicide means it comes as judicial hanging. Judicial hanging, it is one of the short answer question. Judicial hanging. See, judicial hanging is method of execution of legal death sentence in India. Execution of legal death sentence. It is one of the deaths. Judicial hanging is a death sentence in India. Execution of death sentence in India. What is the procedure? See, it is very easy. In cinemas also we can see hands are tied back and made them stand on the tap door. Hands are tied and made them stand on the trap door. Trap door is suddenly opens and then the sudden suspension will occur. Before the sudden suspension, his face is covered with a black mask and ligature material also put on the neck cover the face, and ligature material put on the neck. This material is prepared for 5 to 7 meters suspension. How much suspension should be there? Because by using the material, 5 to 7 meters suspension. Knot is under the angle of jaw. Put the knot at the angle of jaw, not at the occiput. Put the knot at the angle of jaw. On drawing board, the person drop the length of the drop. The person drops to length of the rope. Length of the rope 5 to 7, minimum 5 to 7 meters suspension should be there. After the placing the knot at angle of jaw, then draw the bolt. The person will drop to the length of the rope. Then it leads to sudden stoppage of moving body, causes moving body undergoes stoppage due to dislocation of, why stoppage of moving body? Dislocation of fracture of atlanto occipital joint like C2, C3, C4 vertebra. Dislocation of C2, C3, C4. And upper cervical cord is stretched. Cervical cord also stretched, and brainstem also injury. Both fracture occur and injury will also occur. Stretched and injury. Next, immediately unconscious and death due to vital centers undergoes damage, undergoes death. But of immediately unconscious, but heartbeat, respiratory movement, some spasmodic muscle jerking continues for few minutes. Asphyxial signs are not seen in judicial hanging. No signs are seen in judicial hanging. Okay, this is the judicial hanging. This is one of the short answer question. First, this is the execution of legal death sentence in India. Then write the procedure. Hands tied, put a trap door, next face is covered, and neck around the neck ligature mark, minimum 5 to 7 suspension. After the present the knot at the angle of jaw. After drawing, will person drop to the length of the rope. Sudden stoppage of moving body because of C2, C3, C4 vertebra damaged. Along with damage, cervical body undergoes stretched and brain stem injury. Brain stem also got injured. Immediately unconscious. Unconscious because of vital centers are damaged, but heart rate, respiratory, some spasmodic movements are continue for few minutes. Asphyxial signs are not seen in judicial hanging. Next, Hagman's fragments. Hagman's fracture I discussed previously. Wait a minute. Hagman's fracture C2, C3, C4. See that one, bilateral fracture of pedicle or lamella of C3, C4. C2, C3, C4. Fracture of pedicle or lamella of C2, C3, C4. Hagman's fracture comes under also homicidal. Next, lynching or extrajudicial hanging. Extrajudicial, not a judicial. This is called lynching. Hanging a group of people in a public. In public means it is not by judicial, it is extrajudicial, by group of people hanging that person in publicly. This is called lynching. Next, accidental. Accidental is because of accidentally the hanging will occur. How the accidental hanging will occur? That is called auto erection or sexual asphyxia. Because of sexual asphyxia, hanging will accidentally occur. Sexual asphyxia is an important short answer question for university exams. It is also called philia. Philia means liking. Hypoxiphilia, asphyxiophilia, coaguarism. Other names are like sexual asphyxia means they want that, like philia, hypoxiphilia, and asphyxiophilia. What is asphyxiation? Asphyxiation in this sexual means sexual gratification, most common in male perverts. What is the mechanism of this sexual asphyxia? Partially the neck compresses, carotid artery compresses when they're hanging, hanging with one hand. Mm, there is a partial neck compression, then undergoes carotid compression. Because of carotid compression, no oxygen will be there, no, it leads to cerebral ischemia. Because of cerebral ischemia, there is erotic hallucinations will occur when the organism will occur. Suddenly there should be by using the other hand, the person should release the knot, release of compression. Person should release the compression, then it comes to normal. In accidental cases, they are unable to release that knot, so it leads to death because of sexual gratification. This is called sexual asphyxia. Partial neck compression leads to carotid compression, cerebral ischemia, erotic hallucinations, and organism. Okay, this is the accidental. This is a form of masochism. Other signs are the signs of crime. We can see not only this, we can see transvestism, pornographic any materials, naked body, and no suicidal note. All these are signs of sexual asphyxia. Okay, transvestism and pornographic material, naked body, no suicidal note is present in these cases. So this is the total discussed about the hanging. Okay, See, first I discussed about the definition. How the definition. Next, I classified based on knot and based on suspension. Next, I discussed about the causes of hanging, and I discussed about the appearance like external, internal appearance, external ligature mark, ligature mark, and ligature material. Next, I discussed about the face appearance and dribbling of saliva. Next, protrusion of tongue and leaf facey sympathetic to go. Next, neck. Next, about the wait pedicle hemorrhages and post-mortem staining and urination, defecation, erection, seminal ejection. Next, I discussed about the internal like thyroid cartilage, hyoid cartilage, an important one. Next, carotid artery injury and vertebral artery injury. Emerson sign here, Hagman's fracture and Simon's hemorrhage. Okay. Next, I discuss about the manner of death like suicidal, homicidal like judicial hanging and lynching, and other one is Hagman's fracture. Next, accidentally sexual asphyxia. Thank you. Please subscribe my channel and please support us. Thank you.